Hello, Mr. Alator. My name is Jenny Canales. I'm presenting Persuasive Speech, Communication 181, Hopkinsville Community College. Good evening, ladies and gentlemen. My name is Jenny Canales, and today I'll be talking to you about sexually transmitted diseases. Sexually transmitted diseases, sometimes they call it STDs and venereal diseases, or sexually transmitted infections. Today I would like to talk to you about STDs, not in a broad way, but just a small glance about this problem. In the middle of my presentation, I would like you to think about it. Think, do I want this? But at the end of the presentation, hopefully I will be able to convince you that sexually transmitted disease is a very prevalent problem in the United States. And hopefully you will be convinced that you need to prevent this and protect ourselves. Sexually transmitted diseases. Okay. Some of the sexually transmitted diseases I'll be talking about. Consist of the causes of the sexually transmitted diseases are bacteria, protozoans, or parasites. The first one that I'm showing you is the most prevalent one. It's chlamydia. And the cause of this chlamydia is bacteria. The signs and symptoms are purulent drainage. Purulent meaning there is a white, yellowish discharge. And usually the person experiencing this disease have frequency and painful urination. They also experience fever and irregular bleeding. The treatment of this disease is usually by using antibiotics. Genital herpes. The cause of this is a virus. The signs and symptoms, we usually have painful ulcers, as you see it right here. They have a painful and burning urination. The treatment of this, I'm sorry guys, there's no cure for this because it's a virus. Syphilis, the cause of this is bacteria. Signs and symptoms, they have painless erosions. You have flu-like symptoms, you have fever, headaches, you have rash in your palms and the soles of your feet. And the treatment of this one is usually antibiotic. But if you leave it untreated, it causes heart diseases and possibly death. Gonorrhea. Again, the cause is bacteria. The signs and symptoms again is yellow discharge, painful and frequent urination, nausea and vomiting. You see, and the treatment is antibiotic. There's also a frequent urination with pain and burning sensations. And it comes with sometimes a bleeding, or with women it's spotting. Again, the treatment is antibiotic. The next one is a very prevalent one. It's candidiasis. It's caused by fungus. The signs and symptoms are white, cheesy, kind of purulent drainage. And there's a lot of pruritus or itchiness with this disease. There's a lot of vaginal or penile inflammations. There's fever and chills also. And again, the treatment is antibiotic. Trichomoniasis. This is caused by protozoans. The signs and symptoms, they usually have a white patches, also like the candidiasis. But most of the times, the signs and symptoms are symptomatic, meaning you might not know it that you have it, and within 1 to 3 weeks, the signs and symptoms will be shown, and it's usually frequent urination, burning pain, dull pain, and discharge, yellowish, whitish discharge that also comes in green or yellowish, and it's malodorous. It's very, very fishy smell. And the treatment of this disease is antibiotic. Ladies and gentlemen, this chart right here in front of you is a chart of reported cases of sexually transmitted disease, and you can see the most important thing that you can see right here is the the chlamydia. In the United States, 1,200,000 is affected by chlamydia. Ladies and gentlemen, this is a very prevalent problem, and it's not only men and women, but even children are affected by these diseases. And I would like to convince you that you need to prevent this one with simple hand washing, simple, just use condoms. It lowers the risk of getting these diseases. And of course, talk to your doctors. Education is a must. You want to learn more about these diseases, you can do that. And of course, abstinence is the most important. No sex at all. But of course, ladies and gentlemen, at this end of the presentation, I hope your opinion about sexually transmitted diseases are changed. Protect yourself, prevent these diseases. Thank you so much. This is the end of my presentation. And if you would like to know about this presentation, please go to www.cdc.gov or www.emedline.com, or you can check out this nursing handbook that I have in here, Foundations of an Adult Health Nursing. Thank you.